As you think through the new normal of healthcare, patient care is still top of mind. I wanted to kind of give you a sense of my experience as a patient and making sure some of the things I saw and some of the guidance and areas that I think can help you as a provider will guide you as you navigate this new normal of healthcare. And a great many of the doctors I talk to and physicians, they display that in spades. If you're a medical practice owner, you need to be aware of the personal challenges that your patients are facing, navigating. I'll tell you my story. As a patient myself recently, I had to understand exactly how to navigate this challenging environment of healthcare. So I'm going to tell you my journey, and hopefully you'll glean a little bit about how this can help your patients, especially if you're a provider and you're a provider owner that wants to provide more value, you want to care more for your patients, you need to understand the challenges they go through. So recently I had a situation with my knee. It was a shock initially because I was about to travel and I saw this big splotch on my knee. My wife, who happens to be a nurse, said I need to go check it out because I was about to travel the next day or the next couple of days, and I wanted to make sure there was not going to be any issues with traveling. Well, I couldn't go immediately to my provider because obviously getting a visit to your provider in such a short notice is tough and difficult. So that's challenge number one, access to you. I can, in some cases, book a telehealth visit with him or maybe see him shortly, or maybe a nurse practitioner or a physician assistant, but seeing the doctor themselves is always difficult and it's a challenge to schedule at a late notice like that. So I had to go to the urgent care ED. So when I went to urgent care ED, they saw it, they initially looked at it and they said, you know what, we may need to do a deeper analysis. And so that's when they brought in the ultrasound tech to kind of look at the knee because it's really red and splotchy, right? It didn't look right. And when they did the analysis, they determined I had a blood clot in my left knee. And they were just like, okay, this is serious. You need to get on aspirin and you probably can't fly, right? Because those are very serious conditions. Well, needless to say, I was like shocked and just like, oh, what do I have to do? Then began the arduous journey of getting referrals. I potentially had to see a hematologist, right, to understand what's going on there. I had to understand if there was any issues with the veins, so I had to go see a vein specialist. And so booking these specialists was problem number two. It's difficult. And then all the paperwork you had to fill out to get these referrals set up and all that. That was very difficult in that journey. And so I went through that process to fill all the paperwork out and try to understand all that. And it was very difficult, right? Because you're scheduling time and trying to see someone and you wait in the office forever just to have someone talk to you for a little bit. And then they put you on some medication and then they say, okay, come back in about a month and see what happens. So this whole time, this is around the beginning of the year, I could not travel at all. So it was detriment to my business because I have to travel a lot to go visit everyone. So when I kind of waited around, kind of saw the vein doctor, then went to see the hematologist, they did a lot of blood work to make sure there's no other issues. And that's definitely something important. But they decided to put me on this blood thinner, Eliquis, and I was just like, you know what? This is something that I'm not sure about. Blood thinners, have a lot of other issues. Yes, can help your body accelerate the blood clot. Being on blood thinner prevents you from traveling a lot. You have to walk around a lot. You have issues. If you get cut, you will bleed a lot potentially. So that was something I did not want to be on indefinitely, right? So I wanted to kind of accelerate this process. And so when I actually came back to see the hematologist, obviously blood work, they said everything looked fine. And there was no issues there, right? When it comes to any issues in the blood, right? Maybe like cancer or anything like that. So that was a relief. But then I went to go see the vein doctor and they had the ultrasound tech actually after a month kind of look at everything and they couldn't find anything. They didn't see anything at all. But I did notice that my knee still hurt. So to me, I thought, was I misdiagnosed? And that could have been the case in that situation. But needless to say, throughout this whole process, I'm racking up bills, right? Insurance bills from the primary care doctor, from the ED visit, right? From the ultrasound tech who initially saw me, to the hematologist, 2 visits, to the vein doctor, 2 visits, right? All to say that they probably didn't even have an issue anyway with a blood clot. It may have been misdiagnosed. And now I'm going to see a orthopedic person to kind of see what's going on with my knee because it's still sore there. And there's other issues going on, not dealing with a blood clot. And so to me, that just was aggravating. And so when I kind of went through that whole process personally, I realized that, you know what, this is something that a lot of patients go through, right? You have an ailment, you want to get it resolved, right? And I would say this, US healthcare is very well versed on taking care of emergency visits, right? If you need emergency surgery, you're in a car accident, definitely that's very well done. But when it comes to kind of these chronic conditions, we always kind of fail a little bit with that, right? When it comes to like preventable diseases, all that, and that's a lot of healthcare is going, right? Because they want to kind of keep people away from these other issues. Episodic care is great, but when it comes to longitudinal type of conditions like heart disease, diabetes, I do feel like the healthcare system drops the ball a little bit. And so as a patient navigating all that, how can you as a provider kind of work with your patients to understand and go through that process? Well, number one, I would say when I went to go see my primary care doctor, he was on his computer, right? There's CPT codes tied to time you spend with the patient, 15, 30 minutes, and you have to slot patients in based on that. I would say you have to do better job of understanding if a patient is going to need more time. Yes, if you are under a healthcare system, right? If you're not independent, you're going to be driven by volume. And so you're going to have to see more patients. And I get that, totally understand. But there has to be some kind of leeway and allow you those 15, 20-minute blocks in order to spend more time with the patient. Because your patients want to talk to you. I can remember feeling rushed. And I'm in healthcare, right? And I was feeling rushed by my provider, just trying to deal with understanding what was going on with me and kind of explain everything. Matter of fact, I had to bring my wife, who is a nurse, kind of talk even more clinical, right? I knew a lot of the terms and knew how to communicate well, but I needed to bring my wife in to even talk even more deeper to other things that the doctor wasn't considering because he was just going by if he could find the code in the EMR, right? And I think that's a challenge too, right? And so one thing, obviously, really helpful to navigate that would be making sure you dictate, having some kind of system that dictates automatically. There are some great AI systems that are coming on the forefront that allow you to dictate while you're talking to patients so they can see you eye to eye, right? And you can communicate with them, understand what's really going on so your patients don't feel rushed. That's key because sometimes it takes a while to kind of divvy up. As you can imagine, it's really about empathy and having a sense of if you were in the same position, making sure you're having questions answered correctly and making sure someone cares, right? And I think that's really what it boils down to. And a great many of the doctors I talk to and physicians, they display that in spades, right? Making sure they show care. But I do feel like that's something that can get lost even by the best physician when you're focused on the bottom line, volume play, and trying to meet your numbers and being on the computer at the same time. It's hard to give the patient undivided attention. So I would say that's number one, figure out the tools and technologies that replace the technology, so you can still have a formalized communicative opportunity with your patient to understand what's going on with them. Number two, making sure you have a front office desk staff to have conversations with patients. I would say this, my doctor was rushed at the time. I will say the front office and the staff that when I called back, they were very responsive. His nurse team was very responsive and communicating and trying to get back to me effectively. I think that's really key. I think a lot of it could be alleviated if that's more on the front end, right? Even before the patient comes in, getting a sense of what's really going on so they can kind of prepare better and slot that time more effectively. I think that's really important. And obviously technology can help there as well, right? Having software solutions to help you slot patients in more effectively when it comes to appointments, right? So that patients who need a little bit more extra time can get that time if you just do a little bit up front, right? With the front office desk staff and also with calling the patients prior to them showing up for the appointment, right? Yes, you can use tools and there's tons of patient survey systems that you can text the patients and stuff like that. But I think there has to be that call, right? In order to kind of communicate, because that starts that personal journey with the patient. Yes, I get it. You have to automate some things. Can you make it as easy as possible for one human being to talk to another? And I guarantee by having a front office that speak out to a patient really helps alleviate some of the anxiety that a patient will have facing you. As you can imagine, sitting in that room waiting to hear the doctor and understanding what's wrong with you. Also, 9 times out of 10, patients are gonna need blood tests, right? Or some kind of test. So is there a way to figure out how to get a lot of these tests up beforehand, right? I would say you need to kind of see them and talk to them, but if there's a telehealth visit where there's some initial conversations you can have, a lot of those tests can be probably done beforehand. I think that could help as well, right? So looking at ways to use technology to reach out to the patient beforehand to get a better sense of things and then order the tests. Because obviously you're visiting, the first visit just kind of get to know each other and all overall. The second visit is really kind of look at the diagnostic, right? And so it's kind of like those 2 visits, could they potentially be combined to one depending on the condition of what the issue is, right? So I'm advocate for definitely person-to-person conversations, but sometimes it's just a matter of making sure you hit the right data effectively. And think about it, the pandemic, COVID, we did this effectively, right? We had tons, hundreds of thousands of telehealth visits, right? That allowed us to communicate to patients and and do well and understand exactly what was going on with the patients using video technology. And I think that's very similar. You can do the same. Now, obviously, telehealth reimbursements are changing. They're looking at different ways of maximizing that, and utilization's way down. Estimates, I think, is down to near like 10 to 15% of all visits are still doing with telehealth, when the high was around 85%. So that is still the standard. But I do feel like there needs to be a better way to kind of think through that a little bit more effectively, right? And so, like I said, the goal as a patient who's experienced the healthcare system on both sides, working behind the scenes with the doctor, kind of implement technology to make the patient feel a little bit closer to the doctor, right? That's what these remote care programs do that we offer: remote patient monitoring, chronic care condition, chronic care management. They're about making sure the patient feels connected to the doctor, right? Even with technology, because if I'm taking my blood pressure or if I'm getting labs results done and that information is shown to my doctor, so my doctor is talking to me, he already has some semblance of what's going on with me. I feel heard. I feel that the visit wasn't a waste of time. And I think that's really something that as a medical practitioner, you have to kind of understand that. And I think millions of doctors understand that, right? Hundreds of thousands of doctors understand that across the country. It's something that we have to go back to, right? Healthcare has changed dramatically with the advent of technology and tools, but the tools can be instrument to help get a better person to patient or patient to doctor communication channel. And I think that's what we have to get to and thinking through that process. As someone who saw that process on the other side, I saw the frustration and then obviously the transparency in billing, right? Not understanding what the bill's going to look like, have a clear sense of that. Who does this real well? Dentists. I've seen dentists actually sit down with you. Not all dentists, but some of the well-run ones. They actually sit down after you've done, kind of before you do the procedure, and actually go into a separate room and walk you through the scenarios of what's possible, right? And say, hey, do you want this? You want that? This could be extra. Because sometimes you don't even think what's extra for some of your services, right? So for instance, if you go to the dentist, fluorine is extra, right? Or fluoride to put in your teeth. But if you think about it from a provider standpoint, doctor, making sure that your patient feels comfortable, what to expect. And a lot of times you may not even know, right? But if there's extra tests, they need to be aware that tests cost money. They need to know those initial visits cost money. Now, outside of that, there's other things that are in other scenarios, and make them aware. One big thing that's happening right now, GLPs, all these different type of weight loss drugs or diabetes drugs, they're on the forefront, right? And they're looking at making sure that patients get the resources they need, but you have to go through these steps, and they're putting more barriers in front of it because it's harder to get access to these drugs. Just the shortage. And one thing my doctor did do was very well in communicating that, right? He said, hey, this is process has changed, but there's avenues around that. We can use telehealth in order to have a conversation so we can get access to different drugs that may not be accessible anymore. And so, like I said, these are all things that kind of think through when you think about your patients and using technology to kind of remove those barriers so you can have a clear conversation with them and making sure they feel at ease. And ultimately, you feel like you're doing your job as best you can and not feel like a cog in a machine. Especially if you own your own practice, you are getting bombarded by different scenarios, right? You have value-based care programs trying to come after you, especially your primary care doctor. You have over-top retailers, you have telehealth offers, you have third-party vendors coming in trying to take your patients. So the more you can provide value, connection to the patients, the better you will feel overall. And so that's the key to this thing. You have to stay connected to your patients, just like a customer and a sales rep. They have to stay connected, right? To make sure that all their needs are met and taken care of. And so as you think through the new normal of healthcare, patient care is still top of mind. So hopefully you enjoyed this video. I wanted to kind of give you a sense of my experience as a patient and making sure some of the things I saw and some of the guidance and areas that I think can help you as a provider will guide you as you navigate this new normal of healthcare, right? And so if you like this content, look, I have tons of different videos from anything from value-based care to remote care programs to understanding clinical studies. Check it out. Let me know in the comment section below if you thought this video was helpful, and check me out next time on next video. And also smash like, do all you can to get the latest information when we release it.